Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome, everyone, to Understanding the Human Condition with your host, Dr. James Flowers.
Hey, Robin.
How are you?
I'm doing great. And we have the amazing Dr. Paul Fortes today that I'm so
do.
excited to have.
Yes,
I'm
our
happy to
VIP
be
guest, episode 5.
Yeah.
Thank you so much for being here.
Oh, thank you for having me.
You bet.
It was a pleasure.
Dr. Fortes and I know each other because we met. We work in the same building, 5 Post Oak Park, right here at San Felipe and Post Oak Parkway. And we're able to meet. And we'll talk a little bit more about why we know each other as we go on. But I thought what I would also talk about is I'd like to introduce Dr. Fortes, if that's all right. Dr. Paul Fortes is a double board certified plastic surgeon. He is an artist and a leading aesthetic plastic surgeon at the Aesthetic Center for Plastic Surgery Spa and Rejuvenation Center. Dr. Fortes sees patients in 2 beautiful facilities that I personally have seen in Memorial, Town and Country area, and the Galleria River Oaks District in Houston, as I said, at 5 Post Oak Park. Dr. Fortes has built a very strong reputation over 22 years, and he's been in private practice as an aesthetic plastic surgeon. Dr. Fortes has become a global leader in aesthetic plastic surgery throughout his career. He's lectured to international plastic surgeons in the United States, Canada, Mexico, Panama, Israel, and Malaysia. And Dr. Fortes has been recognized by such plastic surgery societies all over the world. Dr. Fortes is well known for total and 3-dimensional body contouring by liposculpture and fat micrografting techniques, as well as hidden incision body lifts. He is also well known for and has a large practice of secondary corrective aesthetic surgeries of the body and breast for patients wanting corrections of surgeries performed elsewhere. We can talk a little bit about that as well. Dr. Fortes is honored to be named the 2020 Super Doctors List. Is that in the world or in Texas?
Jeez, I'm not sure. I think it's in Texas.
I'm going to say the world, right? Dr. Fortes is honored to be named in the 2020 Texas Super Doctors List. Being selected represents only 5% of doctors in the state or region and represents a list of outstanding physicians who must meet a stringent selection criteria. It's a multi-step process is undertaken, and it is assessed in order to be considered if that physician is qualified for the Texas Super Doc designation. Doctors who achieve the highest point totals from the combination of peer surveys, primary research, and blue ribbon panels are selected for the Super Doctor Texas 2020 list. Being selected for this achievement is one that Dr. Fortes truly values and honors. Dr. Fortes combines his artistic vision with the latest technical advances in plastic surgery to give his patients the results they deserve. Outside of his practice, Dr. Fortes can be found enjoying time playing classical piano, drawing, doing photography, supporting the arts community in Houston, and volunteering for and supporting organizations that benefit animal welfare.
Awesome.
Living in the ethnic melting pot of Houston, Dr. Fortes is a self-identified foodie who likes to spend time with his close circle of friends enjoying Houston's incredibly diverse restaurants and cultural scene, which has been difficult this year in 2020.
Oh, tell me about it. That's why it's so painful being a foodie and the restaurants are closed.
Yeah.
It's like, what do? You
and
eat
I
your own food?
Yeah, we've had a few
Yeah.
Do you cook?
conversations
Yes, you
about how
cook.
difficult
Heck
this year
no.
is. Yeah, heck no. He's a foodie. He wants to go out and eat.
Yeah.
Absolutely. It's a pleasure having you again.
Yes.
Thank
Pleasure
you
to
so
be
much.
here.
Being here.
Absolutely. How did you make the decision to choose work in the field of plastic surgery?
Well, I was completely honest with myself.
Yeah.
You know, I had always had an interest in doing things that were artistic in nature.
Mm-hmm.
And when I went to high school, I had teachers and mentors that supported my growth in, particularly in math and science. So I loved math and science when I was at that age,
Right.
and they were incredibly supportive. I think that's so important for people, young people these days, to have mentoring.
Absolutely.
And that's really what steered me in the direction that I went. So I went very heavy. You know, when I went to Rice University and I studied chemistry and chemical engineering,
Wow.
thinking that that was my life goal.
Sure.
And at some point I said, no, this is not what you're going to do,
Right.
because it seemed quite isolating to be in a lab by yourself,
Mhm.
doing an experiment for hours and hours.
Right.
And I did that, and I looked out the window and I said, I'm not doing this.
No.
And I switched gears at that point and made a conscious decision to do something where I was involved in taking care of people, or at least interacting with people. So I changed my major then, and I went into pre-med,
Mhm.
and then went to medical school across, as they say, across the hedges at
Yep.
Baylor College of Medicine.
That's right.
And I did my education there in medicine, and then I left Texas for 8 years, and I did general surgery. Again, there was a sort of a process of discovery, because my dad, when he was alive, loved medicine, especially loved internal medicine.
Sure.
So I pictured myself doing that. And when I actually did it, I was bored to death.
Right.
And
Yeah.
so the last thing that I thought that I would be was a surgeon.
Right.
But the honest truth is that that's really what filled me and filled my passions, and
Yeah.
I loved it from the beginning. And I thought I was going to do general surgery, and then last minute turn, you know,
Yep.
these things happen in your life. My mom said, well, you would make such an awesome plastic surgeon. Why don't you do that? And so I said, well, let me check that out. And so I came full circle
Right.
from, you know, doing heavy math and science to integrating my artistic interest.
Amazing.
And so it's a perfect match right now.
Yeah. And you matched your passion with
Yes.
what you do every day. And I
Yeah.
can tell, certainly in our conversations and our visits throughout the last year or so, that you absolutely have a passion for beauty, have a passion, you're an artist. I know several patients that you have performed surgery on that just not walk out, but weeks later, days later, say, oh my gosh, I cannot believe how amazing this is. And so kudos to you on the work. And you have such an amazing reputation in Houston, and your passion certainly shows that.
Thank you.
Can we talk about all the different services that you do provide?
Sure.
Yeah.
You know, I do aesthetic plastic surgery. I'm a surgeon by training, and aesthetic plastic surgery is what I do for a living. So you can imagine almost anything that has to do with changing the body so that it looks better. Already the body is normal. My practice is not one of reconstruction, and there are plastic surgeons who do reconstruction. In those situations, it's because the body's been injured or something has happened to not make it be normal. The people that come to see me have normal bodies. They just want to make a change to feel and look better. And so I do everything literally from head to toe. A lot of facial plastic surgery, eyelid surgery, rhinoplasty surgery. I love doing rhinoplasty surgery. That's one of the things that I enjoy the most. Body contouring surgery is really one of the core elements of my practice. Breast aesthetic surgery of all kinds, from reductions, augmentations, lifts, and any combination that you can imagine of those. Nowadays, we're recycling fat, and that's kind of the hot thing, or it's been the hot thing over the last several years. So we're not throwing the fat away, we're using it as part of the body contouring process. So, and one of the big areas is, you know, the behind.
Yeah.
And so those are the things that I do. And of course, I'm in a group that also understands that not everyone may be ready for plastic surgery. Not everyone may qualify to have plastic surgery for whatever reason. And so we offer non-surgical procedures as well in our practice of all kinds. And we have 2 beautiful spas and estheticians and nurse injectors that do a lot of the services that we provide there, from facials to non-invasive removal of fat, to tightening of the skin with treatments such as Thermi Smooth and RF treatments. That's one of the big treatments that we offer these days that's non-surgical, and it's really offered an expanded menu to patients who may not be ready for plastic surgery.
Let's talk a little bit about body contouring. And the reason that I'm asking about that is because, you know, I'm in my mid-50s. I have been a runner all of my life. I've run 28 marathons and have been very physically active. And men tend to have something called the flanks here. And I'll tell the audience that today I came to you and said, Dr. Fortes, I visited with Cindy, who's sitting over here behind the screen over here, and said, I have some flanks. I can't get rid of them. I run all the time. I run 10 miles on a Saturday. What do I do? What can you do to help me? And you suggested body contouring and I, you know, under my belly button all the way around. And so could you talk a little bit about body contouring in the male population?
Absolutely. Well, everything that you said makes you a perfect candidate for it because you're a runner, you're disciplined, you lead a healthy lifestyle, and these are genetically determined problems that are beyond your physical control. And it's a perfect example of what you mentioned too. Men tend to have a little bit of a gut. That's where the fat tends to concentrate, and then the waist or the flank area. And so when you're doing everything you possibly can to create sort of the body that you desire, but things are just being stubborn and not changing, those are the ideal patients to come for plastic surgery because the plastic surgeon can certainly correct those things that are beyond your control. Where plastic surgery doesn't work is for people who are not doing those things, who have maybe a weight management problem.
Right.
And they come for plastic surgery thinking that plastic surgery is going to cure them or treat them, and the opposite is true.
Right.
There's no treating. That's not a patient that long-term will have a successful outcome from plastic surgery.
So in other words, when you post plastic surgery, then I need to eat right, I need to continue exercising, I need to live a healthy lifestyle, continue running, and if not, will it come back?
Not if you maintain it.
Right, yeah.
And you know, you didn't have to make a radical lifestyle change because you're already living the life of, you know, health.
Right.
And so it's going to be easy for you to keep the results that you have.
Well, I don't know if it worked on me, but what I can tell you is that probably 7 or 8 of my friends have come to see you after me, and they tell me glowing remarks about you. Of course, it worked for me. And I'm going to brag a little bit and just say the only thing about 2020 is COVID, and I didn't get to wear a swimsuit very much this year, and I was so disappointed. I had it done on December the 31st.
2021 is your year then.
2021 is my year, and I'm super excited. And I'm not embarrassed to say that I had it because you know what? It is a lifestyle, and we want to look our best, and we want to feel our best, and we want to have confidence. And when I stand up and speak to an audience or I'm working with patients, I want to look my best, even with a suit or with a shirt on. You can certainly see now somewhat of a V where I didn't have that before. So thank you for that. What is your favorite, if you had a favorite procedure to perform in your surgery center, what's your favorite procedure?
I love operating on women who don't have the figure that they desire. And for me, I don't want to say it's easy.
Yeah.
Because it implies that what I do is easy. It's not easy, but I love transforming those women's bodies, and they are beyond thrilled.
Yeah.
When they see the results. And men do too, but men are, you know, men's bodies are supposed to look like men's bodies, not a woman's body.
Right.
And so you can't, they don't mix and match. You can't do on a woman something that you do on a man and vice versa.
Sure.
But I mean, I love doing all kinds of plastic surgery. Obviously, it is my passion.
Yeah, it is.
But you asked me, you kind of put me on the spot.
I did.
You asked me what one procedure I like. I love doing that.
Wonderful. I also know that you are well known in the trans community. Can you talk a little bit about that?
I've been operating on transgender people for decades, and I don't know how they found me, but they managed to. And then once they found me, you know, their friends followed.
Right.
And so I never thought of them any differently than anyone else. I mean, they came because they had something that they wanted to change about their body, just like all other plastic surgery patients want.
Yeah.
And so I offered that as a service, and they were equally thrilled with the results. And I never encountered any issues related to any psychological issues from doing these changes. Obviously, they've lived in their skin for all their life, and they know what they're about. And so I don't think that they're any different from anyone else.
No, of course
in
not.
terms of dealing with it psychologically.
Yeah, oftentimes I say in my practice that in the trans population, they know themselves better than we know ourselves even. You know what I mean? They know who they are. They know who they should be. They know who they want to be. And when they make that decision...
I think the people who have the hang-up are the rest of us.
Absolutely. Yeah. You're exactly right. Yeah, well, kudos for that. I think it's so important. A really wonderful friend of mine in Los Angeles and Hollywood owns La Fuente Hollywood Treatment Center, Manny Rodriguez, and it's specifically an LGBT treatment program. And about 30 to 40% of his patients daily are in the trans community. And that is one of their issues, is sometimes, unfortunately, in that community, there's not enough resources to have surgery. And so I know that that's also difficult. And but thank you for supporting that community. And
Absolutely.
I think it's so important.
Sure.
Robin?
Well, we wanted to talk a little bit about body dysmorphia disorder. How about that? So let's talk about the definition and how do you discover it? And
Sure. Well, it's a disorder, I think, of perception, that people that with it don't see themselves as others see them. They take very minor flaws or maybe no flaws at all and magnify them. And it's almost the equivalent of they look at themselves in a mirror, but it's a funhouse mirror where the image is completely distorted and not really a reflection of reality. And so they live their life based upon that self-image that is not within normal. And a perfect example, I mentioned that I love rhinoplasty surgery. Rhinoplasty, if I were to pick a procedure that plastic surgeons do, probably has the highest rate of all procedures to attract patients with BDD.
really?
Yeah, and so they may see their nose as horrible, twisted, with a terrible shape, when you and I may look at them and says, there's nothing wrong with your nose. Your nose is fine. It suits your face. I don't see any major flaws. But they magnify what they see, or maybe there's nothing there, but they create this image in their head. And of course, it's very unsettling to them. It creates a lot of distress in their life, and they modify their life according to the belief that they have about their appearance. And that includes focusing multiple times a day on looking at themselves in mirrors, making adjustments to themselves, not meeting appointments, whether it's work appointments or social appointments, simply because all that time has been focused on dealing with what they see in the mirror. And it's a very distressing thing for them to go through. And often they turn to plastic surgery to fix the problem. And I'm here to say that unfortunately plastic surgery doesn't fix the problem, and sometimes makes the problem worse, because what happens is that you don't really address the issue, and you only think you're addressing the issue, and then they are terribly disappointed that really fundamentally what they see is no different from what they saw before.
Right.
Well, and I wanted to ask and involve you on this. How does a loved one approach the subject of body dysmorphia to someone? And should you do that alone, or is that something that you should do as a physician? Because will it trigger worse symptoms if I were to go to a friend and say, hey, I'm noticing, yada, yada, yada?
Well, I'm certainly not a physician, but Dr. Fortes is. But you could call me a shrink, I suppose. And what I would say is that, just like Dr. Fortes said prior to this show, we were going over some of these questions, obviously, and you approach that person with love, kindness, and gentleness. And you can discuss, certainly, here's what I see and here's what I hear, and can we talk about this? And do it in a very loving, caring way. Because certainly if you sit with someone and say, you're always saying you're fat and you're not fat, get over it, then what does that do? Puts their feathers up and they get into an argument. And certainly a professional like myself, a therapist, can certainly sit with them and talk to them about body dysmorphic disorder or even diagnose body dysmorphic disorder. So I think the subject can be brought up by your loved ones, but the treatment and the proper diagnosis should be done by a professional, of course. So I think when you bring that subject up and you broach it, like I said, it's just love and kindness and a gentle conversation. Yeah.
So do you see that quite a bit? I mean,
From what I understand, it occurs in about 1 to 2% of the general population. Probably among the population that comes to see a plastic surgeon, it's closer to maybe 10 to 15. And for rhinoplasty, as I mentioned, it's probably a full third of patients that come for rhinoplasty that may actually have it. So it's not those are not small numbers. And so I think all plastic surgeons have to sort of have their antennas up for someone that has that diagnosis. And you, as I mentioned earlier to you, I have a limited time with patients that come to see me to get to know them and understand their concerns and worries and how I can involve myself in offering a service that might enhance their life, not make it worse. And sometimes you can spot them immediately. I've been doing this for a long enough time to kind of see signs and symptoms of it. But, sometimes you can't. And sometimes the patients will have plastic surgery, and often they do have plastic surgery and a ton of it before a diagnosis is even made. And so, if someone comes to my office and they're 30 years old and they've had 15 aesthetic plastic surgeries, I mean, that's a red flag.
Right.
Yeah.
Absolutely.
Right.
Yeah.
Or someone who comes in and what you see, you don't detect what they see, and they make, and it's extremely distressing to them, the body part that they're describing to you, and you look at it and you say, you have a beautiful nose, or you have lovely lips, then that's a warning sign too.
Yeah. I've probably performed between 2,500 and 3,000 gastric bypass behavioral evaluations over my 30-year career. And many of those patients post-evaluation, if they eat the proper diet and they lose the weight and they exercise and they do what they need to do, oftentimes we've seen people come to plastic surgeons. And would you call that, is it a skin revision, or what do you call the skin reduction surgery?
Yeah, skin reduction surgery. And it sometimes it happens in all over the body. It can happen in the face, it can happen in the breasts, it can happen in the arms, thighs, you name it.
Absolutely.
And so, we have operations that are designed to address each of those areas of the body with a way to make the body look better and get rid of the loose skin. And the loose skin, certainly, they may not be happy with the way it looks. Sometimes it's also functional, that it's just in the way.
Yeah, absolutely. Yeah. In that population that I've treated, one of the reasons we do pre-surgical evaluations and pre-surgical mental health evaluations really is to help determine whether that patient is going to be able to adhere to a new diet, a new lifestyle. Do they understand the risk of the surgery? Do they understand it's a radical change having a full gastric bypass surgery? And do you ever find yourself talking to a patient and recommending therapy or recommending a therapist along with the plastic surgery or prior to plastic surgery decisions?
I think more patients should have therapy than the ones that are getting it. I think it's a wonderful thing because it's a self-discovery process, and you can learn a lot about yourself and what you're doing that's working and not working, and make lifestyle changes based on that. And specifically patients who are going through major life change, from going sometimes 400 or 500 pounds to going under 200 pounds. They're a different person.
Right.
Physically, psychologically, emotionally, and of course, I think getting support for during that process is extremely important.
It is. It's so important prior to and after. I know that I've filmed several episodes of my 600-pound life over the years, and talk to those patients and really coach them and guide them and give them advice prior to surgery and help the doctor determine if it's an appropriate surgery or not. But you're right. I think that all of us, everyone sitting in this room and everyone listening to this show right now, therapy is just a wonderful thing in our life that we can have someone really to sit in front of and just discuss and listen and get feedback on our own lives, and whether we're thinking clearly and whether we're thinking, is this a good idea or is this not a good idea?
Well, it's the reason you're so successful today, because as a child you had a lot of trauma, right?
I did.
And if it wouldn't have been for that therapy,
that's right.
you wouldn't be here today.
Yeah. No, I had a very traumatic childhood growing up, and my mother introduced me to the thought of psychiatry and therapy, I think, in about the 5th or 6th grade, right after my father died.
She was ahead of her
Thank
time.
She was ahead of her time.
Exactly.
Yes. It was in
Yeah.
the 70s when psychiatry was so, I think my mother went through 20 years of Freudian psychotherapy herself, which was amazing, which is probably what I do why I do this today. Well, again, go ahead.
Well, I was just going to say, so what is, once you've diagnosed it, what is the treatment? How do you treat that?
Are you talking about body dysmorphia?
Body dysmorphia.
Yeah. So, certainly the therapy of choice is really cognitive behavioral therapy. And what cognitive behavioral therapy is doing is just changing a paradigm and having a paradigm shift. So in other words, changing an idea, right? Talking through it with someone and working through it. It's just like, one of my specialties is working with somatic symptom disorder. Similar but different than body dysmorphic disorder. And somatic symptom disorder, it's a long treatment process, right, in therapy. And the same thing in body dysmorphic disorder is you encourage a healthy eating lifestyle, you encourage a healthy exercise program, you bring in a nutritionist, you bring in a physical therapist, you bring in an exercise physiologist, you have psychotherapy sessions, and really changing negative thought patterns and turning them into a positive thought pattern, right?
Yeah.
And I'm going to take a moment and just say, because my mask keeps falling down, usually we don't wear masks while we're doing this. And I'm doing this out of respect to Dr. Fortes, because Dr. Fortes is in the operating room several times a week, and we want to make sure during this time of COVID that we all remain safe. And so that's why we're all wearing masks today. And it's just important. And he is hyper vigilant about that, in which he should be. And so thank you for doing that.
This is my OR uniform right here.
Absolutely. That's
Wear it every week.
That's right. Walk us through, if you don't mind. I remember when I came to see you as a patient, it was an amazing process. I literally checked in at the front desk and made an appointment with Cindy. Tell us about Cindy and what Cindy does and how valuable she is in your practice. Because to me, she was invaluable. She was almost my psychologist preparing me for surgery.
I'm going to run the risk of embarrassing the heck out of her.
Let's do it. She's sitting in the room, everybody.
She's my right-hand girl.
Yeah.
And without her, my practice would not really exist.
Right.
Because, I try to be the best plastic surgeon that I can be, and that's always been a goal of mine. But without her, that would not happen.
Right.
Because I need her to be really work with me hand in hand so that patients can have a great experience from beginning all the way through to the end. I certainly cannot do her job.
Right. Yeah.
And she does her job beautifully.
She does. I mean, I just remember back in December when I was coming to visit, literally, she walked me through just from day one on the first visit, post-surgery, talking to me. I sent a good colleague of mine who is a psychiatrist to see you that actually lives in Beverly Hills and practices both in Beverly Hills and Houston. And he came in, and he is used to the Beverly Hills lifestyle. And he said, James, I have never seen a practice with such perfection as Dr. Fortes' practice. And it's true.
Wonderful.
That's
From the
awesome.
front desk person at your office, when you walk in, they know your name. They welcome you. It's one of the most beautiful medical offices you've ever been in. And then you get to meet the gorgeous Cindy that's sitting over here. And she explains everything and explains the process.
I'll
and
tell
why
you
you're there.
something. She's more beautiful on the inside than even on the outside.
You know,
Speaking
I
for
know
her.
that. Yeah, she is.
Yeah.
I told Robin French here sitting with me that Cindy, I said, just wait till you see her. She's gorgeous. She's flawless.
Yeah.
And I will also say that secondarily on the inside, just as beautiful. And that's what also makes your practice successful, is it really is a customer service oriented experience. So anyone out there that's even thinking about plastic surgery, how do they find you? What, other than knowing that you and I are in the same building at 5 Post Oak Park, but how do they find you and get a hold of you or Cindy?
Easy. Gosh, they can call call me
Mm-hmm.
or call Cindy.
Yeah.
And her direct line, we use it kind of like the bat phone,
Yeah.
is 832-898-2044.
Excellent.
Or you can text.
Yep.
Everybody loves texting.
I
these
text her all the
days,
time.
So you can even text,
Yep.
which is wonderful. You can call the main office, which is an easy number to remember, 713-799-9999. Or you can call and make an appointment to see me at one of our 2 offices. We have an office in the Memorial City area, Town and Country, and that address is 12727 Kimberly, Suite 300. And our other location is 4400 Post Oak Parkway, also Suite 300.
Yes.
And so, or you can just go on my website.
What's that
You know,
website?
FortesMD.com.
Fortes,
TES,
FORTESMD.com. That's right.
Awesome.
Dr. Fortes, thank you so much for being a part of
Thank
this
you.
today.
Oh,
I
my
respect
pleasure.
your work so much.
We were looking forward to this.
You're amazing. You are an artist, and you bring a valuable service, I think, to the city of Houston. So thanks for being here. And Cindy, thanks for coming along with him. And so you guys reach out to Dr. Fortes and Robin.
And Dr. Flowers, can you explain how they can find us at the J. Flowers Health Institute?
You bet. Absolutely. Our phone number is 713-783-6655, and our website is jflowershealth.com.
Thank you, everyone, for listening in. Thank you, Doctor.
Thank you.
Yeah. Have a great week, everybody. See you next
Absolutely.
week. Yeah,
Bye-bye.
thanks.